Good afternoon, everyone. Thank you so much for joining us for this COVID-19 press briefing. Today, Orange County Mayor Jerry Demings with a word of congratulations for the vaccination team at the Convention Center and the great work they're doing. He will have details on several open vaccination sites and opportunities that exist for those who still have not yet been vaccinated. The mayor will also discuss our testing locations and including 2 new locations and positivity rates as well. The mayor will discuss our upcoming partnership event with a health institution to reduce vaccine hesitancy in our community. Orlando Mayor Buddy Dyer is here, and he will have information regarding vaccination sites in the city and rental assistance programs that are in the works. We're happy to have Dr. Pino from the Florida Department of Health also here to discuss important details regarding infection rates and state vaccinations. We begin with Mayor Demings. Mayor?
All right, good afternoon to everyone. Thank you all for being here. I want to start by sharing some milestones with you. One of the things that Dr. Williamson talked about was the vaccination site at the Orange County Convention Center. And today marked the 100th day of operation for vaccinations at the Convention Center. We have been under a state of emergency with our Emergency Operations Center activated for 406 days, so obviously better than a year now. The Barnett Park testing location has been open for 210 days, and the Convention Center testing site has been open for 385 days. A little bit of factual tidbits there. Since late December, the site at the Convention Center has been the place to get vaccinated, and you really never had to get out of your car. And so we've received great feedback from our residents and others who have gone through the experience there at the Convention Center. So let me just say thank you to all of the personnel who have been working at that site to ensure that it runs smoothly. That includes representatives from the Florida Department of Health, Health Services, the Orange County Fire Rescue Department, the Orlando Fire Department, and others have been working at the site there at the Convention Center. So thank you, Mayor Dyer, for the partnership as well. So far, the site has administered nearly 240,000 vaccines. Combined with our mobile outreach efforts, the total number of vaccines administered there at the Convention Center and the mobile sites is 254,390 doses. Currently, the Convention Center has plenty of appointments that remain open. So if anyone in our community that is eligible, 16 and older, would like to get vaccinated, we have numerous appointments available. So if you want to get information, please go to our website at ocfl.net/vaccine. If you cannot make it to the Convention Center, there are a variety of mobile sites that will be operating throughout the county. For example, tomorrow, shots will be administered at the Bravo Supermarket on Oak Ridge Road, Mount Pleasant Missionary Baptist Church in West Orlando, and El Presidente Supermarket in the Pine Hills area. Also, we ask that you remember that the Florida Department of Health in Orange County has more than 120 different partnerships with vaccination sites throughout the county under the state mandates and oversight. So please find a location that is convenient for you if you desire to get tested. You can go to the FloridaDisaster.org or ocfl.net/vaccine websites for additional information. As it relates to Orange County's current COVID-19 mobile vaccination site, it is located at the Silver Star Recreation Center, which will continue serving the surrounding community through tomorrow. As a reminder, tomorrow's vaccination event is walk up only. In other words, no appointment is necessary. Since Monday, more than 1,475 shots have been administered at the Silver Star location. And now the news flash for next week. Where will we be next week? Orange County will operate 2 new mobile vaccination sites on the east side of the county, The locations are Meadowwoods Park Recreation Center that will operate beginning on Monday, April the 26th, and it will operate on Tuesday, April the 27th. Or you can go to the Goldenrod Park Recreation Center on Thursday and Friday of next week. The mobile sites will operate between the hours of 9 a.m. and 6 p.m. and will provide options for appointment or walk-up service. Up to 1,000 Pfizer brand vaccines can be administered per day. And we are truly excited about these sites in East Orange County, and we hope that many of our residents, especially the Hispanic population, will take advantage of those locations. As a reminder, for 16 and 17-year-old residents, a parent or legal guardian must register them for their appointment, sign a consent form, as well as be present at the time of the vaccination. In an effort to encourage our student population to get vaccinated, we're working with Florida Department of Health and Orange County Public Schools to provide vaccination events at 3 high schools next week. Another news flash here. On Wednesday, April the 28th, the mobile vaccination sites will be operating at the gymnasiums located at Colonial High School, Evans High School, and Jones High School. Again, Colonial, Evans, and Jones High Schools next Wednesday. Since the start of the pandemic, there have been a reported 133,211 positive cases of COVID-19 reported in Orange County. 1,231 residents have died from the coronavirus. Our 14-day positivity rate continues to increase. Today, Dr. Pino reports that it is at 8%. That is 0.4% of an increase from Monday of this week. As far as the percentages of county residents who have received at least 1 dose of the vaccine, 59.2% of those 40 years of age and older now have had at least 1 shot. And overall, 34.3% of all Orange County residents have received at least 1 dose of the vaccine. Again, anyone 16 and older is eligible. I want to remind everyone that testing is still important. Barnett Park remains open 7 days a week for free coronavirus testing. They offer the rapid or antigen testing or the PCR test. On Monday afternoon next week, we will be partnering with Advent Health and the Florida Department of Health in Orange County to present a panel discussion about vaccine hesitancy. Dr. Pino and I will be there along with medical experts to discuss COVID-19 vaccine options and the need to be vaccinated. I invite you, the media, to participate and cover the event. Orange TV will be broadcasting the conversation live. This collaboration is an extension of the county's I Got My Shot public safety initiative. It is another outreach effort to help make residents aware of the safety, convenience, and benefits of receiving the vaccine as soon as possible to build community immunity. Again, the town hall will be Monday. It will be at 4:30 p.m. And now with that, I'm going to turn it over to Mayor Buddy Dyer.
Thank you, Mayor Demings. Thank you, Mayor Demings. It's only Thursday, too. With more and more of our residents having access to the vaccine in recent weeks, we've seen much change in our community. When I visit our city small businesses or attend events like last weekend's Harbor House's Pause for Peace Walk, I see a renewed sense of hope. I see energy in our citizens knowing that if we continue on this path, we can get back to normal. But something that hasn't changed recently is that the pandemic continues to impact so many in our region in many different ways. And as a community and as individuals, there are still many ways to support our neighbors in need. So that includes making a contribution or volunteering your time to Second Harvest Food Bank to fight hunger, donating blood through One Blood to help save lives, and certainly shopping small to support our small business owners and their employees. So I've only named a few ways, and I'm certain that you can figure out many others to offer assistance and to keep our local economy moving forward. Throughout this pandemic, as a city, we've made sure that our community has been there to help some of our region's most vulnerable, including the chronically homeless, and we're doing that through partnerships. Last week, we joined the SALT outreach to cut a ribbon on the city's first mobile laundry service trailer. The trailer provides free place for homeless individuals to clean their clothing. Through our partnership, this trailer will be in addition to the services SALT already provides to those experiencing homelessness, which includes portable shower trailer, haircut, storage services, hygiene products, food and case management. Together, we can work to ensure that the basic needs of hygiene and food and clothing are provided to our most vulnerable. I want to mention some of the sites that will be open for mobile vaccination thanks to the Florida Department of Emergency Management. No appointments necessary, walk-up locations and dates. April 23rd, Mount Pleasant Missionary Baptist Church. April 24th and 25th, Trotters Park. April 27th, Camping World Stadium. May 1st, Festival Park. May 2nd, the Farmers Market at Lake Eola Park. May 5th, Washington Shores Shopping Plaza. May 8th, the James R. Smith Neighborhood Center. I would encourage everyone that hasn't been vaccinated to get vaccinated. It's an easy process, and everybody has that opportunity. Lastly, I wanted to highlight that on this coming Monday's City Council agenda, we'll be considering an agreement with KPMG to help administer the City Rental Assistance Program to help city households get current on unpaid rent. The program is federally funded, and to be eligible, a household within the city limits of Orlando must have experienced financial hardship due to COVID and have a household income at or below 80% of the area median income. So for a family of four, that's about $60,000. Once we get our partnership in place with KPMG, we anticipate opening an application portal sometime in mid-May. Residents who are interested in applying can go ahead and visit orlando.gov/assistance and sign up to receive updates on the program. With that, Dr. Pino.
Thank you, Mayor. Good afternoon, everyone. Mayor Demings gave you some of the numbers, so I'm going to quickly go over those. The total number of positive cases in our county, including resident and non-resident, is at 133,211. Our positivity rate continues to be at 96%, and our 14-day, that's our recovery rate is still at 96%. Our 14-day rolling average is at 8, as the measure mentioned. That was just PCR results. It does not include rapid testing for obvious reasons. And also the number of deaths are 1,231. We have 3 additional deaths that occurred since we talked to you last. And I always, 1 is too many, but I always want to call the attention that the numbers that we are reporting every week in the number of deaths continue to decrease week by week, and that's what we would like to see and expected to see as the vaccines become more available and also so effective. 2 female, 1 male, 1 black, 2 white, and all non-Hispanic. All 3 had underlying conditions. Also, I want to show you some of the hospitalization data. Can we go back? Okay. So this is the median age for hospitalizations. And you cannot see it here. I'm going to show you after smoothing it. But the age of those hospitalized continues to decrease. And that's an important, so if you see the dotted line, it really declines. The hospitalization age is declining quickly, meaning people who are being hospitalized are younger and younger. And although young people do not have the poor outcomes that we experience with older population, there is also risk associated with hospitalizations. So That is to say that we want to prevent this from happening, and the way to prevent this from happening is from getting the younger segment of the population vaccinated. This is the hospitalization by age group. So we separated by different age group to see which group is declining, is getting hospitalized younger the most. And you can see here that is the 25 to 49-year-old group of people that are getting hospitalized. It's also increasing for 5 to 24 in the dotted yellow line over there. And the gray line, 25 to 49, as I mentioned to you, is the one with the highest number of people getting hospitalized by age group. So it is critically important for parents to exert influence in younger individuals to get vaccinated. And they are not getting vaccinated at a higher rate. Yesterday, we only vaccinated a little bit over 200 people. And we say us, meaning the royal us, in the entire county. Only a little bit over 200 vaccinations for younger than 18 were reported yesterday. So it is so, with regard to the variants, we have a total of 240 in the B117, 9 in the 427, 10 in the 429, and 2 in the 351, and 6 in the P1. None of the, only a little bit over 67 cases of those with variants has been hospitalized, and no one has died that we know of those cases. With regard to the portal continued to be open for today, still appointments. There are appointments for tomorrow, and there are appointments for Saturday. We have not opened the schedule for next week because, as the mayor mentioned, we are quickly realizing that it's a decrease in the demand for the vaccine. We actually have more vaccines than appointments taken by our community. We are operating the site about 50%, and it's mostly second dose Pfizer that we are giving at this point. That is to say that perhaps we may look for a solution where we'll have multiple smaller sites around the county, because we think that we have top off in the group of individuals that will come to the convention center, they have the vehicle and the time and the resources to do that. So we have to now get closer to the community. And as we explained to you before, our objective at the time was to vaccinate quickly the highest number of individuals possible. And we think that we are getting there with the convention center. So with that, we have our 100 days today. It was a celebration. I think we have some picture. I don't know if you can show it. That's the cake, and we have cupcakes. And the next picture. It may come. May not. Well, if it comes, we show. So let me rectify something that I realized that I said wrongly. When I mentioned 67, that number, and I say variants, I was talking about throughout cases. Those are the ones that are over 67 cases, and no one has died from those who have breakthrough cases. Breakthrough cases are defined anyone who have a confirmed PCR test after 2 weeks from receiving the second dose, meaning getting infected after being fully immunized. With regard to vaccinations, the total doses administered in our county, and we know that we are under-reporting in this case because we still have not received the information for April the 2nd, which we haven't been able, that's the file that is corrupted. We haven't been able to access that. We access one of the day, not the other. And also, we have not received information from the VA hospital. So we know that we are off by a few thousand. But right now, the total number of doses administered, these are not individuals, these are doses, in our county, 818,496. And that is an increment of 10,456 from yesterday. So yesterday, 20,456 vaccinations were reported to the state. The number of Orange County residents with serious completed, mean first and second, or Johnson & Johnson, 307,590, and that's at 21.73% of our total population. Remember, this is total population, and we're only vaccinating 16 and over, so there is room there for also increasing percentage. And that's what comes next. When you look at residents over 18 that have been vaccinated, the percentage goes up to 29.2%. The mayor mentioned to you that over 40, we are at 43.2%, and people over 65 years old, we are at 69.7% of completed series. For residents that have received one dose or more, the mayor mentioned to you that we are at 34.3%. And yesterday, we gave 208 doses to individuals between 16 and 18 years old. We need that number to go up dramatically. We also want to encourage people to continue to wash your hands, wear your mask, watch your distance, and protect yourself and others. We are really, really close. We are on a tipping point. We need to increase the vaccination rates for those younger than 25 years old, and we will be in a very good place if we'll get those percentage a little bit higher. Thank you.
All right, thank you, Dr. Pino. We have several people on deck today. If there are any questions for our Spanish-speaking media, we have Commissioner Myra Uribe. We have my special assistant, Ms. Ilia Torres. I don't see Commissioner Gomez-Cadero today. We also have from the school district, Mr. Scott Howard, who's here, the Director of Public Safety for the county. Danny Banks is here, and then Mr. Tim Boldick with our compliance team. So with that, we'll open it up for any questions at this time.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. Dr. Pino, when you talk about having more doses than appointments right now, and not to beat a dead horse, I know we've talked about this hesitancy problem a lot, but when you look at the numbers, about 35% right now, and you know we have to get to at least 50% or so to drop the mask, and then we're looking at 80% or so to get out of this. Are you concerned that we're still this low, or what are your thoughts on this, and what would you maybe say to people who are just absolutely against it?
So I think that we're probably closer to 40%, taking consideration the state is saying that between 5 to 8% should increase when we added the VA data. So we need to reach that, we need to pass that 50%. That's a magic number when things start happening. Because then you can say, with 50% of the population vaccinated and the number of natural immunity that we have in the community, then we can make a better calculation on how protected we are. And with that comes also the ability to have some normalcy, and perhaps even to relax some of the, not that I'm putting myself in the mayor's shoes, that will be his decision, but getting to that point is where we could start changing things. And things has gone very well for us. We have vaccinated quickly a very large number of our population, and now we are going to use a different strategy and try to move closer to schools and places that are in the communities, so that we are walking distance for someone that may not be able to come. There are going to be some efforts also. We started going to farms and orchards. We did that this week. We went to Monterey Farms and vaccinated a couple of hundred individuals there. Also to the Farmers Association in Apaca. So we are trying to go to those places because we understand there are a group of individuals, especially that are working in agriculture or in tourism, or even in other part of the service industry. It's very difficult to take time off. And that's why the president was also encourage companies to give individuals the time off so that they can come and get vaccinated. Because getting to the convention center with an hour and the appointment and the traffic and other things, it becomes a half a day venture for many people. And if you don't have the ability to take that time off, it becomes very difficult. So that's why we may slide into night shift in some areas, some days, if we need to try with that, do more weekend events, and also coming closer to the community.
Buenas tardes, Alibet Suárez para Telemundo Orlando. Mi pregunta es para el doctor Pino, si nos pudiera decir en este momento cuál es la comunidad más afectada con casos positivos en coronavirus y si esta comunidad, está participando en el proceso de vacunación, si nos pudiera explicar un poco.
Sí, mira, no tengo esos datos enfrente de mí. Si nos mandas ese requerimiento escrito, te lo puedo enviar. The question was, which is the area of the county most affected by the virus and how that area correlates to vaccination rates? And I responded that I don't have that data in front of me, that if she sent me that request by email, I can look at it. Gracias.
Dan Messinio with Spectrum News 13. This question is for Dr. Pino.
Yes.
And Dr. Pino, with the slow pace of 16 to 18-year-olds being vaccinated, do you think that it's going to be possible to reach a herd immunity status by July 4th?
That's a difficult question to answer because it will be all a guessing game. If things continue to be the way they are today, probably not. But I don't know what the yield is going to be from those efforts that we are going to engage with next week. I hope that we can get closer to a number. But going from a 40% to a 79, 80% in such a period of time would be difficult. It will require a massive amount of work. And taking the opportunity that you asked me this question, I forgot to mention that we are hiring again for additional trace investigators in our webpage for the health department at Orange County. There is going to be a link. We are looking for individuals that are multilingual as we try to address some of our multilingual communities. And also we will prefer people who have a background in public health or a master's in public health. We are hiring probably additional 20 individuals. So we are open for business again.
This is Melissa Thomas of Florida National News. This question is for Mayor Demings. Obviously, given your experience in emergency management and the milestone you shared earlier that, Orange County's been in a state of emergency for over 400 days, what's been your biggest takeaway with the handling of the pandemic from that emergency management standpoint that you haven't experienced before?
Well, every crisis is somewhat different, but at the same time, they're all the same. And we use, at least I use a strategy called the ICER approach, I-C-E-R, where we look at isolation, containment, evaluation of the dynamics before us, and then we report out to the community to communicate what we're doing. And so we've done all of that over time, and probably the biggest takeaway is that this is a dynamic environment. This is a pandemic, a 100-year kind of an event that none of us have ever really lived through before, for the most part, and so we're learning. The virus is changing before our very eyes, and we have been successful in adapting to the environment that we find ourselves in. So I believe that the critical thing that makes us as successful as we possibly can is the ability to make decisions in a timely manner. And we can only do that with collaboration between the federal, state, and the local authorities.
Hi, this is Nikki Zizaza with News 6. This question is for Dr. Pino. Dr. Pino, have you guys been able to identify, you mentioned that there's been a decrease in demand, however, at the same time, you guys do have, excess vaccine at this point. Have you been able to identify that? Because I know previously, you guys have been, really successful in identifying, all right, Memorial Day, and then soon after that, this is what we have learned. What time frame and what window of time did you start seeing kind of that decrease in demand here in Orange County?
After we opened to the general population of 18 and older, we saw a decline. And it has to do also with the fact that there is a traumatic effect to a pandemic like this. It's a mental health trauma when you experience and these type of large events. And for the community at large, but especially for those who saw their peers dying from this. And that's the older segment of the population. So of course they were a higher risk and they all rush to get vaccinated because they have a sense of urgency. That's not the same for the younger population who in the first half of this pandemic, if we are counting the half before vaccines and then after vaccine, in the first half of the pandemic, they were mostly asymptomatic and not requiring hospitalization. But now the virus had changed. We have multiple mutations. Those mutations will continue to happen. Every time that the virus jumps from an individual to another individual, that's an opportunity for a mutation. And when those happen, it could mutate in a way that makes it resistant to vaccines. That has not happened yet that we know. And it could mutate in a way that is most aggressive with younger individuals. So this is the time to get vaccinated. We have the vaccine, we have the appointments, it is free, there is no excuse not to get vaccinated if you want to get vaccinated. We cannot force everyone, but at least we can make it available for those who want it.
Is there a question back? Do we have a question in the back? Okay.
I do have one.
Okay,
Mayor
we have
Demings,
one.
Dr. Pino, this question comes from Brian Lynch with the Orlando Business Journal. He asks, what role might local employers have in helping to maintain the pace of vaccine doses being given?
That's an interesting question because we are in conversations with some of our partners. It was not our idea, it was their idea. They approach us and we may start talking to some of the largest employers in the entertainment industry and service industry so that we can bring vaccines to big hotels and big tourism centers, and some of the parks are vaccinating already, so that we can effectively provide those individuals that may not have the time to take the time off to be able to get the vaccine. But that collaboration and the willingness of the employers to have these services or operations is critical.
Okay, thank you all for joining us today. This will be the last press briefing for this week. The next briefing is scheduled for Monday at 4:30.